Hello, and welcome to this video which will display right-sided endoscopic sinus surgery. My name is Stephen Hauser, and I will hope to teach you a little bit about sinus surgery in this video. First, what is done for this patient is to perform an uncinatomy. What that means is that the uncinate, which is a shelf of tissue, bone, which is surrounded by thickened lining, is actually incised or cut with an instrument, and then what you will see in the video is teasing away of bone from the inferior aspect of this uncinate so that we can then more easily utilize a microdebrider to remove both the inferior and the superior aspect of the uncinate. In the process of removing the inferior aspect of the uncinate, you will notice that the patient has a hole beyond. That hole is actually the patient's natural maxillary antrostomy. So in removing the uncinate, we have exposed the patient's natural maxillary antrostomy, and frankly, no further surgery needs to be done to their maxillary sinus. We now have that nicely opened by removing the very thickened edematous uncinate process which overlies their maxillary sinus. What is done as well in this video is the patient's bulla ethmoidalis, the anterior air cells of the ethmoid air cell system will be removed. The way this is done is by carefully inserting a suction through the face of the bulla ethmoidalis and then using that hole to then introduce a microdebrider, which is used to remove a portion of the face of the bulla ethmoidalis and then remove the entire bulla ethmoidalis, maintaining lining over the lamina papyracea. The bone to the immediate left side of the screen actually overlies the patient's orbit, or their eye socket, and therefore we want to leave that tissue as much as possible. Immediately superior to where we are working is the skull base, or the fovea ethmoidalis, and beyond that bone actually would lie the patient's brain. Now you will notice at the end of this video that a probe is being inserted superiorly, and this is actually entering into the region of the patient's frontal sinus outflow tract. And what we're doing with this is just ensuring that indeed their frontal sinus outflow tract is open and really no surgery needed to take place there. That probe just ensures that it is indeed a good functional area. Now, you will notice that there is some bleeding during the surgery, which is not at all unusual, especially given the swelling that we see in this patient's lining. There is a great deal of edema, and therefore the lining, as it is incised, does tend to ooze. Now, as I mentioned, the important structures that are nearby, both the eye and the brain, we do not tend to cauterize the tissue in order to try to control any oozing, but rather we allow the patient to form blood clot and to calm down any bleeding on their own. As you could imagine, it would be fairly dangerous to perform cautery right next to the eye or right below the brain with the thought of any injury possibly transferring to these areas. This patient, at the conclusion of their case, would typically have some type of spacer device, a dissolvable material, passed into their sinus cavity, and that would then be suctioned or removed 1 week following surgery. Patients really tend to tolerate that quite well. It's much easier than what we used to use in terms of a great deal of packing material, which frankly patients hated and really did cause them a great deal of discomfort. Fortunately, now we do not need to utilize such material. We have better options available to us. The patient will be asked to not blow the nose for a 2-week period of time. They will be asked to use a great deal of saline to flush their nose to help wash away blood clot and so forth, starting on the first day after surgery. They'll be asked to not exercise vigorously, and usually people will take approximately a week off from work. It depends on how active someone's work is in terms of how quickly they can go back to work. The pain level with a surgery like this hurts about as much as getting sort of bopped in the nose. Most people have had the experience perhaps of banging their nose with a car door, or perhaps a child or a dog sort of bopping you in the nose. It hurts about that much. Fortunately, though, the patients are able to take pain medication, and as well, we'll put patients on antibiotics for approximately a 10-day period to help prevent potentially any bacterial overgrowth that can occur with the blood that will be a little bit pooled in the sinus cavities. Patients are seen 1 week after surgery for cleaning, and that is done in the office. This surgery typically is done as an outpatient, meaning that the patient will have surgery and go home that very same day. So they need to come with a responsible family member that can bring them home. I practice both at the Cleveland Nasal Sinus and Sleep Center and as well at MetroHealth, and I'm happy to see you to assess your nasal and sinus needs. Thank you for watching this video. The phone numbers will be listed at the end if you wish to contact me and have me evaluate you for your nasal condition. Thank you. Have a great day.